To hear more about this conference and the Pan-African Women in Health, being the PAWH, we're joined on the line by the founder and executive director of the Pan-African Women in Health, Belinda Ngongo. A very good evening to you. Thank you for your time and welcome.
Thank you so much, and good evening to you too.
Firstly, perhaps let's start here. Tell us about the Pan-African Women in Health. Is it an organization, a movement, and what were your intentions with it when you started?
No, thank you so much for the question. And I think, having worked around the continent and globally, I noticed a gap. I noticed a gap where, a lot of African women lacked support, they lacked networks, and some of the time, like during COVID, felt lonely. They didn't know where to go to. So we really created Pan-African Women in Health to support women and really groom the next generation of leaders, ensuring that, we provide them with things like mentorship. We also change the narrative because when people think about Africa, they think of some of us living in cages. So PAWH tells stories to really change the narrative. And in addition to the mentorship piece, we also really foster partnership to increase professional development, but also to ensure that, women are reach their full potential.
Yeah. And, perhaps in looking at the bigger picture, why is it so important to have a dedicated platform focused on African women in health at this very particular moment as we look at how society is going and some of the health trends that we've seen and some tragedies also in the health space?
So first of all, women make up 70% of the healthcare workforce. And in Africa, they might actually that number might be slightly more. And the strategy is there's not a lot of women, although despite making 70 to 75% of the healthcare workforce, many women are not in leadership roles. So, and as you know, when we say in Africa, if you educate a woman, you educate an entire nation. So we need to make sure that African women in health, who are 70% of the healthcare workforce, are really supported so they can conduct their duties. Secondly, we've had a lot of changes when you look at the geopolitical situation, when you look at the recent funding cuts, when you look at the different aspects of life, including things like climate change, you have things like AI coming through. So we want to make sure that we have a healthcare workforce that is ready, for all the challenges that we're currently facing. And I think we want to stay on top of the game and ensure that, women also have a voice. They're not only the recipients of policies, but they're also part of the discussion and shaping these policies.
Because Africa in itself carries a very significant burden of disease, yet women remain underrepresented in many of the spaces where health policy is concerned and investment decisions are made. And I know that Paul talks about moving beyond dialogue into collective action. What does that actually look like on the ground as one tries to assess some of the concrete outcomes?
I think, and that's really the big discussion that we're going to be having in the next 2 days that we're having, today and tomorrow, is really coming up with concrete actions, concrete elements that need to be actioned. I don't think we're going to just have another declaration that is not going to be implemented. What we really want to do is work with our members, but also people in the community, some of the leaders, to ensure that these actions are implemented. I think that's the main thing. I think the problem that we have in Africa is we have a lot of meetings, but no implementation. There's a problem with implementation.
Yeah.
So we want to move beyond that so that we have true accountability.
Because your conference brings together women from all walks of life, different parts of the continent and across different sectors. How important is that cross-border collaboration where when there's many, many challenges of Africa's biggest health challenges and, of course, ones that shouldn't stop at the national borders?
I think it's important to have a collective voice as African, because then otherwise we have, again, fragmented systems. Or we have systems where a country says this, another says this, and then when you have, for example, a project, it's very difficult to implement because the voices are very, very different. So really what we're trying to foster here is having a dialogue with people, with the ladies representing different regions, so that we can align and then we can kind of have a common voice. That's really what we're trying to foster.
And what are some of the conversations that will be discussed as, different women come together?
I think one of the ones, like for example, um, sustainability of our health systems, and what is the role of women in those health systems. Trying to elevate that conversation is something that we're doing. Another one is collaboration. We realize that not one sector can implement or take care of some of the intervention at national or even regional level. So there's a need for collaboration between the private sector, the public sector, the NGOs, and even the government sector. But then another one is, of course, talent. There's been a lot of shift on the on funding that has impacted the healthcare workforce. A lot of women are unemployed, underemployed. So how do we fix that? How do we ensure that women are equipped to deal with the new realities in the healthcare workforce?
Because that is essentially the elephant in the room, isn't it? As we take a look at donor funding, which we saw starting to disappear in 2025, because it's one of the conversations that are under discussion in the conference. What approach are you looking at as you try and navigate that, and also just emphasizing the importance of collaboration? Because with collaboration should come opportunity.
Exactly. So I think for us as well, we need to think really beyond that and say, does donor funding actually work? How can we collectively start really thinking, have some bold ideas? Because when you look at our theme, it is what now? That's what we call our conference. It's strong roots and bold futures. So we need to come up with bold ideas, because for the last 30 years, we've been depending on external funding. So maybe bringing different minds from younger generation to older generation, thinking about boldly how we can address it. We don't have a solution yet, but I think we realize that we cannot rely on donor funding.
Yeah.
Africa needs to fund other channels.
Absolutely. Thank you very much. Thanks for speaking to us this evening as we wrap up that conversation with founder and executive director of the Pan-African Women in Health, being PAWH, Belinda Ngongo, talking about women's health, bringing together women in the health sector and those keen in that sector from various parts of the African continent, talking collaboration, funding and solutions to the continent's health challenges, and women often bearing the burden of those challenges.